I'm going to go to split screen. Or share screen, I guess they call it. Okay, are you seeing the three guys?
Yeah, I see him.
Okay, then everybody's seeing them. That's great. Uh, I want to revisit something from last meeting, and that's the syllabus. Uh, the syllabus is, except for the two changes that we made together, the syllabus is correct. But I was always uneasy about the way I had formatted it. I was sort of forced into doing it by my Word program at the time, and I didn't particularly like it. And I think it caused some confusion for at least one student, and if for one, probably for more. So uh, even though it didn't have to be changed, I fixed it. So if you go to the syllabus, this is a minor fix. Okay, get rid of that. It has to do with the schedule. And now instead of dates for lecture topics straight down and then followed by dates for lab topics, I have placed them side by side. Okay. And the dates for examinations that are coming up, especially practicums, are bold, as you see here. We already took this February 25th lecture exam one, so I didn't bother bolding yet. Looks like I should have bolded this one. I don't know if I can do it here. Nope, can't do it here. Well, that's easy. That's the easiest fix, is to bold the dates. But here they are. Here's the lab on this side and the lecture on the other. Can you still see the screen?
Yeah.
And this time with the building.
Yes.
Okay, that's great. Uh, you keep learning on this thing. You think, I don't want to learn too much Canvas because they'll get rid of it soon. We'll go back to face to face. I got a letter yesterday. I think you did too, from the president of the school talking about how a lot of the summer classes are going to be uh, hands on. Did you get that or did you read that?
Yes, I received it. It was just really long. I read like half of it.
Yeah, you can only take so much of that guy, to tell you the truth. I've never met him, only seen his picture. He's been invisible to me. Well, yeah, I got that letter too, forwarded, and then I got a letter from my department in biology, and they said all the biology classes are going to be online in fall. They're not even talking summer; they're talking fall. I don't know if that'll really hold true. We can't tell from one day to the next, but I just take everything with a grain of salt, and you can't always depend upon it. Uh, I found also that one thing I could learn is I can set up pages ahead of time, get them going offline. And then when we go to share a screen, I can hit them and there they are. They're online. So live and learn. Maybe I'm just reluctant to use it. Anyway, do you recognize this part of the campus? Anybody recognize where the hand is?
Yes.
That's the what?
The library. How?
No, this one's not the library.
Oh.
This one is the science building. Some of you haven't even been on campus, probably, and some of you have never been into the science building. That's where we would be. In fact, we'd be right about here in the science building for the anatomy lab if we were able to get over there. It's a nice building. A lot of walking for the people who have to set it up, and for the instructors who really have a march. Here's the library. It's over here. Recognize it now? How many floors, for those of you who've been in the library or the LRC, how many floors are
I think 3.
there? I heard 2 and I heard 3. Have you not been in the building? Well, the answer that I usually get is 3. You enter here, right there, go in, and you can go downstairs. Downstairs is down here behind the large ficus trees. Here's the second floor, and the third floor is behind the facade here. Here's the third floor over here. 1, 2, 3. Well, that's what most people think. That's what the signage says, that there's 3. But I've been around the school, as you know, a long, long time, and I know better than that. I think anybody else that knows this is left the school or left the earth. But there's a 4th floor. It's right here where my hand is. It's not big. It's a huge room. Doesn't look like a huge room, but it is when you get up there. You come up through the towers here or over on the other side, and you walk across the roof, and the door is here, and there's a door over here to go in. Now, they hide that. They used to hide it anyway. They would hide it behind moving bookshelves in the library. Didn't want people to know that it was there, but a few of us did. All of the administrators, the president, the vice presidents that we have, and counselors, they were up here. They were up on the 3rd floor of the library. And when this building was put together in 1976, the supervisors were concerned about unrest amongst the students. In some campuses, there had been violence across the United States. Most of you aren't old enough to remember Kent State, but you could look it up if you wanted to. It was a violent situation where the students stormed the administration. So they built this looking like a fort. And I think you can see it looks pretty much like a fort. Okay. And if the students were ever to, if Saddleback Mission Viejo students were ever to storm the building, the administrators would beat it immediately from the 3rd floor into this building here, into this smaller building, which was reinforced, which had food and water and telephones to call the state militia and the governor's office to help get them out because they were barricading themselves in. It never got used. It never got used. It wouldn't get used around here. But that was the idea of that 4th floor. You can see that there's a recording now. That was from Tuesday. Here's where we need to start, 311 today. And it's on the heart. It's a PowerPoint that matches your textbook if you have Merriam. Okay. Now I got to tell you, because I think I already have, I don't like this PowerPoint, but I use it because it does match your book. And so it does make things go a little bit easier. I just don't think it's uh, rendered very well, I guess is the word. Okay. Okay, the heart. Heart's considered a side-by-side pump. In other words, two pumps. One side of the heart pumps blood to the lungs, where oxygen and CO2 are exchanged. One side pumps to the lungs, where oxygen and CO2 are exchanged. The blood picks up oxygen in the lungs and gives off carbon dioxide. Now, anybody who didn't know that from grade school probably isn't going to learn it here. It's just a little bit too easy. The other side of the heart, the left-hand side in red in this drawing, okay, is the part that has received oxygenated blood from the lungs, and now it's pumping the oxygenated blood throughout the entire body, which is shown here going downward, but it means to the entire body in this case. This is showing a little image for us. And then the blood will exchange in the capillaries, in the tissues. The oxygen will enter into the capillaries, and the CO2 in the capillaries from spent blood will enter into the circulatory system. So we have exchange of O2 and CO2 in two places, the lungs and the body tissues themselves. We'll worry about the internal circulation in a moment. You're going to get plenty of that today. The heart is about the size of a fist, and as it says here, easy enough to read, 10 to 12 ounces in weight. Okay. I'm not going to ask you how many times it beats per day. Most of you could figure that out if you know your pulse rate. Pulse rates vary, resting pulse rates for people. Do you know yours? Your normal resting pulse rate?
Around 60.
Around 60. That's a good one. Okay. Some people are around 90. Some people are around 100 for resting pulse rates. Mine's always been 66 every time I go in. Okay. That averages about 100,000 times a day. That's easier to remember. All they're doing here is trying to impress you with a number of things that are happening in the beating heart. The heart is located in the mediastinum. The medias.
Yeah, I'll finish your price.
Okay, we need to turn off mics. Turning off the mic doesn't silence anybody. You just press the space bar when you have something to say, and you don't press the space bar when you don't want anybody to hear what you're saying. Okay, then you can say it anyway. Okay, the mediastinum is the area behind the breastbone in which the heart is located. Okay? I never heard for many, many, many years the word mediastinum. I always pronounced it incorrectly. I thought it was mediastinum. It's just the way I was taught things, but it's mediastinum. I finally heard somebody say it. I checked them on the internet, and sure enough, mediastinum. Okay, that's this area here that's being outlined. Across the top is really the wider side of the heart, and it's called the base, whereas the point at the inferior angle is the apex. The heart sits in at about a 45-degree angle and has a pericardial sac surrounding it. We talked about that pericardial sac earlier when we talked about serous membranes. Now, while it's here, this is the wrong place to do it, but I'll drill it in on the day before the practicum as well. The diaphragm. The diaphragm is a skeletal muscle. Doesn't have anything to do with the circulatory system, I'm sorry, but I skipped this. The diaphragm is the skeletal muscle that separates thoracic and abdominal pelvic cavities, separates the two. And the diaphragm contracts, and when it does, its dome shape, by dome I mean upward shape here, is flattened out. And by flattening it out, you increase the volume of the thoracic cavity, you reduce the pressure, and air is sucked into the lungs. Okay, the thing I want you to remember, please, you can write it down now. You can wait for me on Tuesday because I will not forget the diaphragm. The diaphragm is the prime mover of respiration. It's the main factor in moving the body to breathe air in, respiration. If somebody were to tell me it's the main prime mover in inhalation, I'd have to agree with them with that too, because it doesn't really have much to do with exhalation. But the diaphragm is the prime mover in inhalation and respiration. Okay. Now, I'm purposely skipping a lot of the labels. Some are very easy. Some we've actually done, but I know when the other ones are coming a little further on in this PowerPoint. So you won't be missing anything. The pericardial sac, the sac around the heart. Typically it's presented to you as two layers, but there's really three. The very outermost one, if you were to reach into an open chest cavity and touch the heart, the first thing you're going to touch is the fibrous pericardium. It's a tough outermost layer, almost rubbery. Now they're showing that right here and here. These layers here cover and protect the entire heart. If you could strip the fibrous pericardium away, then you would have the parietal layer of the serous pericardium. Well, we call this the parietal pericardium right here. Parietal pericardium. If you reach the parietal pericardium, it's a thin sac surrounding the heart. Contained within that sac is fluid, pericardial fluid, that rubs against the final layer, but does so as a lubricant, so that the heart essentially doesn't undergo too much stress. The third layer is the visceral pericardium. Now, the visceral pericardium is shown here, and it's only referring to the outermost layer that sits on top of the parietal pericardium. So here's parietal pericardium, but the visceral, not labeled at this point, is here, or it's here. The visceral pericardium is not a loose sac. It is on the surface of the heart itself, cannot be detached normally. The heart is said to be divided into 3 tissue layers, primary tissue layers anyway, and these do not include the muscle layer, except for the myocardium. Okay, so let's do them in order. First one is epicardium. The epicardium is the outer layer of the heart. It's not the visceral pericardium. Okay, it's not the parietal pericardium. Those sacs are removed. The sacs are removed. And now we have the heart itself in our hand. Now with one hand, hold it, the other hand, touch it. And you're touching the epicardium. The epicardium is also known as the visceral pericardium. So if I move back up here, the visceral layer, all right, the outside is visceral pericardium. Visceral layer of the pericardium is epicardium. I don't like the upper diagram, and I don't not terribly fond of the lower one, but this one shows a heart cut in transection, and I'm touching the heart right now with my pointer. This is the epicardium out here. The next layer inside is the muscular wall, which can be thick in some places or thinner in other places. But the muscular wall, no matter if it's thick or thin, is the myocardium. Again, if we get past the slide and you didn't get it, trust me, it's coming again in just a moment. Okay. The innermost layer is the endocardium. Here was the epicardium. Here was the myocardium. Then the inner layer here, just the inner layer, not the thickness, is the endocardium. Anything, as we said the other day, that moves as blood would move through the heart. And if we imagine that can stain anything it touches endocardium.
Which one was epicardium?
Epicardium is the outside.
Okay, thank you.
I just wanted to make sure that I'm clear on this. So the donut shape inside the heart, basically, that is myocardium as well, where it's thick.
This is myocardium, right?
Okay.
What they're showing you here, and they're not telling you this, okay? And I'm not telling you. I'm going to now. I'm not telling you it because it shows up better. I know in pictures to come in just a few minutes. But the donut shape That really look like a donut that you'd eat? That donut shape is the myocardium. Okay, but also so is the thin shape out here. Myocardium can be thick or it can be thin, but it's not the outside and it's not the inside. It's in the in-between. The major vessels, first off, you have arteries, and we defined that just the other day. Arteries always carry blood away from the heart. Always carry blood away from the heart. Okay. As I said, this is a professional set of slides that come with our book, and I'm going to get this out of here right away. Arteries carry blood right away from the heart. That's perfect. Okay. And under high pressures, that's fine too. But oxygenated, yes, the blood leaving from the heart is oxygenated. However, in most arteries, but not all, the pulmonary trunk going to the lungs carries deoxygenated blood. So this word here has got to go. Okay. Arteries are not relegated to carrying oxygenated or deoxygenated blood. They usually carry oxygenated blood, but they don't always, so we can't say that. Okay. Veins carry blood towards the heart, right. Under lower pressures, right. Deoxygenated, not always right. Not always right. Okay. So that's going to go too. It's the direction that veins move. I went over this last night correcting some things, and I can't believe I didn't pull those out. We'll make a good presentation out of this one day. Okay, can you handle waiting for me to take those out tonight?
Yes.
Okay. The vena cava, cava meaning cavernous. Okay. These bring vein blood to the heart. They are veins because they bring the blood to the heart. You have a superior vena cava and you have an inferior vena cava. Here's the superior vena cava bringing blood from the upper body, and returning blood from the lower body is the job of the inferior vena cava. We often abbreviate these IVC and SVC, superior vena cava and inferior vena cava. The only things that move in here are blood that's been through circulation in the adult. In the adult, in the fetus, that's not going to be true, but we haven't got to the fetus yet. The picture with all these labels is reproduced here. So if we want some of the labels, we've still got them. We haven't passed by anything. The pulmonary trunk is the major vessel that carries blood from the heart to the lungs. Okay, well, we don't see the inside, but the vena cava, two of them, bring deoxygenated blood to the right atrium, which is located inside here. You'll see that a bit. Then the blood moves down to the right ventricle, which is located here. And then out it goes to the lungs by means of the pulmonary trunk, that's labeled here, which splits into pulmonary arteries. Okay. Here's an example of a vein, of an artery that carries deoxygenated blood. The pulmonary trunk is an artery, and the blood within it is deoxygenated. branches into pulmonary arteries right and left. And then blood returning from the lungs, which the lungs are not shown here, of course. The blood returning from the lungs comes into here, here, and over here, and over here. 4 pulmonary veins. Since the blood has just gone into and through the lungs, it's been oxygenated, we have veins, 4 pulmonary veins, that are carrying oxygenated blood. So again, we can't depend upon oxygenation state. Now there's a chamber back here, and this is the left atrium. These two over here, these pulmonary veins, reach over farther, but they enter the other side of the left atrium. Blood then goes down into the largest chamber of the heart, which is here. It's the left ventricle. And then when it contracts, it pushes the blood into this red arched vessel. This is the aortic arch. Where my pointer is the ascending aorta. And then we have the aortic arch. Okay, number 3 on this next slide says what we just did. The aorta carries oxygenated blood leaving the heart. It supplies most of the tissue of the body. Coronary arteries, which we haven't looked at yet, supply oxygen and nutrients to the heart muscle itself. Okay, the most important thing that the heart can do is take care of itself first. The heart must get oxygen to its own tissues. It doesn't just filter through layers and layers of cardiac muscle. It's got to get arteries, arterioles, and capillaries to distribute oxygenated blood, nutrient-rich blood to the heart itself. Okay. So here we're going to look at that arch. Here's the aorta. Where did the blood come from? It came from the left ventricle. It's pushed out. The left ventricle contracts and forces the blood out. The blood enters the aorta, and it being an elastic artery, it expands. The left ventricle takes its turn now and relaxes. And that would allow the blood that's under pressure in the aorta to just spew back in. But it can't. It can't come back in. It can only go forward or out 2 little vessels here. And the other one, you can't see the start of it, is right here. The blood under pressure tries to come back, but will be stopped by valves right here that we're going to see in just a moment. The valves have 3 cusps, sort of like the tricuspid valve, but smaller. In 2 of those cusps are these beginning arteries. This one here is the right coronary artery. And this one here, where we can't see the beginnings, is the left coronary artery, which subdivides, going to the back of the heart, going across the front of the heart. So immediately, the very first vessels off of the aorta aren't these up here, aren't any further along. They're way back at the start of the aorta. They're the coronary arteries. You will get asked this. The coronary arteries are the first vessels off the aorta, and you'll be asked to remember that the heart takes care of itself first. When people get plaque build up in the coronary arteries, they're probably going to suffer a sudden unwanted incidents, heart attack, for instance, or myocardial infarction, or angina, which is pain due to not enough oxygen getting through because the plaque is being built up inside. We have 4 chambers in our hearts. All mammals do. The 2 upper chambers are called atria. They have external, they call flaps here, called auricles. I showed you that before, and I'll show it to you very soon again. I'll go over its function when we do it again. We've done it once, but we'll do it again. Okay. 2 atria on the top, 2 ventricles on the bottom. Okay. The 2 atria only have to push the blood that's within them down to the ventricles. The ventricles, on the other hand, have to push it either to the lungs or to the entire body. Septa are partitions that separate the chamber. The only one I care about, although the others are not difficult at all, is the IV septum, the interventricular septum that we looked at the other day. It's between the 2 ventricles. The septum does have endocardium lining it, but within it, the majority of the septum is myocardium. On the walls of the ventricles, there are muscular infoldings. They're showing down here. These muscular infoldings actually allow the ventricles to widen without splitting. They're sort of a cushion in a sense. Okay. They're called trabeculae carneae, which means, as I said the other day, meaty hollows. Okay, now we have a heart that's opened, and we can see some more. The superior vena cava brings blood back. The inferior vena cava brings blood back. One thing that's not showing on this anterior view is that all of that circulation of blood on the surface of the heart, okay, through the coronary arteries that we just looked at, that blood's got to come back someplace too. I hope that there's a good picture, but I have a good picture showing a vein running on the back of the heart, collecting blood that has circulated through the heart and re-entering about here. That's called the coronary sinus. I don't expect you to write that down. I don't expect you to remember it at this point. You will be asked to remember it, but when you say something enough times, it finally will get across. So I don't mind saying it right now, and then I'll repeat it again in a moment. Okay, the diagram just leaves out the coronary sinus, the return of venous blood, and it drops it right into the right atrium. Here's the right atrium here. The valve leaving the right atrium is the tricuspid valve. It's held in place by chordae tendineae, stringy connective tissue that it itself attaches to papillary muscle. Papillary muscle is myocardium. When blood comes in, everything gets out of the way and the blood goes in. When the ventricle contracts, it forces these cusps back shut again. And rather than have them blow backwards completely into the atrium, which would allow the blood to go back, they're held in the shut position by the chordae tendineae. Imagine a swinging Western cowboy door. You go in, you push the two doors out of the way, and then the doors shut, but they don't swing out. We know swinging doors can go both ways. Well, this Western door pushes in, but it will not push out because it has ropes on the other side that hold it from going outward. These ropes are the same thing as the chordae tendineae. Okay. Blood now goes from the right ventricle, which is this, goes up past these structures here. These are the pulmonary semilunar valves. Okay, there are three cusps. You see one here, you see one here, and the other one you don't see. Why not? Because in this oblique section, cut, it's on the piece that has been pulled away. But there are three sails, I sometimes call them. The blood is pushed up into the pulmonary trunk, and then when the ventricle relaxes, the blood in the pulmonary trunk tries to come back down. It can't because it opens the sails itself. The blood forces the pulmonary semilunar valve cusps to open and touch each other. And the harder the blood pushes, the more closed these things are going to become. So the blood has no way to go except further on through the pulmonary trunk, through the left pulmonary artery, through the right pulmonary artery, and go off to the lungs. Okay. Once blood passes the semilunar valve, it is not supposed to get back. Okay. Blood does come back from the lungs, however, through the pulmonary veins, the four here that we saw before. It enters into the left atrium, flows downward through the bicuspid valve, which is more properly called the mitral valve. The mitral valve, or bicuspid, has two cusps and two sets of chordae tendineae attached to two papillary muscles. When the ventricle contracts, the blood goes rushing upward here through this structure. This isn't drawn very convincingly, but this is the aortic semilunar valve, a mate to the pulmonary semilunar valve. The blood goes through, cannot get back, must go on. It works the same way. Now it has its choice as it goes on to go to the upper body through these three vessels, which you'll name later, or to continue on downward behind the heart in the abdominal aorta to the lower body. On the valves of the heart, we've already actually covered them. The tricuspid valve has three flaps on the right-hand side, and it is between the atrium and the ventricle. On the other side is the mitral valve, sometimes called the bicuspid. You won't find bicuspid on my exam, though. Okay. With two flaps, I prefer to call them cusps on each on the left-hand side. Strands of connective tissue that attach to the atrioventricular valves to prevent backflow. These are the chordae tendineae. These are the strings that we looked at. This is just a different way of saying it. The papillary muscle, they often are finger-shaped muscles. They pull on the cords to keep the atrioventricular valve in the ventricle to stop it from blowing out backwards. I frankly want to discourage your use of these two pictures. I don't think they're going to help you or at all. The valves here at the top are showing the tricuspid valve and the mitral valve. The blood in either case goes downward into the ventricle. When the ventricle contracts, this will lift closed, but cannot go any farther because of the chordae tendineae. Here it is. The blood in the ventricle is putting pressure because the ventricle is contracting. This closes. Okay, here it's open. Now these two sides close, and they do not blow back upward into the atrium because of the chordae tendineae, which you can barely see, but it's properly drawn right here. And here's the papillary muscle. This is to show the other two valves of the heart. There are four altogether. Here's the pulmonary semilunar valve, and down here is the aortic semilunar valve. Well, in either case, the blood is going to move from a contracting ventricle and go up through the semilunar valve. This semilunar valve here shows two cusps. There are three. There are three cusps, and out of the four valves, there are three that have three cusps. The only one that has different is the mitral, which has two. The blood moves up between the two cusps that show where's the third cusp. You're standing where it's supposed to be. It's supposed to be on this side. It's been removed. It has to be to show this. So it's easy enough to see how the blood can just barge through. But then when the blood tries to come back down, it fills the cusps. It fills these areas and forces them closed. There's not just two, there are three. The greater the pressure might be, the firmer these are going to be closed. This is the pathway of the blood through the heart. We've done it, but let's do it again quickly. Venous blood enters the right atrium from the vena cava, and at least here they have said it, the coronary sinus. We're going to see the coronary sinus. There are three entrances into the right atrium: superior vena cava, inferior vena cava, and coronary sinus from the coronary circulation itself. The blood flows through the tricuspid valve down into the right ventricle. And then from the right ventricle, it goes through the pulmonary semilunar valve into the pulmonary trunk to the pulmonary arteries, okay, and then to the lungs. From the lungs, oxygenated blood returns by pulmonary veins into the left atrium. Blood flows through the mitral valve into the left ventricle, and blood then flows through the semi-lunar valve of the aortic side into the aorta and onward to the rest of the body tissues. Here's a schematic of it showing exactly the same thing.
Charlie, I have a question.
Sure,
What if someone has like a malfunction with one of the valves in the heart? What's basically like the outcome for that person?
of course, it depends on which valves and how serious. I'm sort of just grasping at straws here for a good answer, but basically, most of the valve problems are valves that don't close properly or don't close properly anymore. And that means that there's going to be leakage of blood backwards the way it's not supposed to be going. The more serious that is, the more serious the situation obviously is. If you're not getting enough blood flow, you're going to get tired quickly, maybe not be able to even walk, certainly not jog and run. Uh, that's all I know.
Okay, thank you so much.
Okay. I had a situation, 25 years ago, and I had to walk from the math science building just over to the BGS building. For those who still haven't been able to get onto campus, they're just one building apart. And I found myself over the course of a semester finding it difficult to make it, and I'd have to go up one flight of stairs, and I was dead by the time I got up there. And like I said, 25 years ago, wasn't expecting anything. And then I'm sitting in my house and having chest pains. And I wouldn't admit to myself that I'm having chest pains. I'm just having indigestion. And I called someone and talked. They said, "Do you want to go to the hospital?" I said, "No, I don't want to go to the hospital." I kept that up till about 3 in the morning. I said, "Let's go to the hospital." Okay, go into the hospital at 3 in the morning, emergency room mission. And the person that sets you down takes your blood pressure immediately. If you say you have chest pains, you don't wait. You get to go first. And so I'm sitting down and I'm looking at the guy, and we look at each other. "Hey, you're my teacher." Oh God, couldn't believe it. And he finished checking me in, and then I have to go into the back area. They inject you with some material that if you do have heartburn, stomach upset or something, it'll end that. But since they used it and it didn't end, it suggested a heart attack. And so now I had to sit in a wheelchair. And now they wanted to take x-rays for some reason. I guess maybe fractured rib could be causing this or something. I don't know. And they're pushing me to the x-ray place. And I can hear this thumping. I mean, somebody big is running behind me down the hall. And it's one of my students again. And he goes, Charlie, how'd I do on that test today? How'd I do on that test today? That was great. He didn't find out, obviously. When they wheeled me out of the place 3 days later, he was right there. Did you find out how I did on that test today? The other day. Anyhow, they decided that I had blockage, right coronary artery, and you go into the cath lab, and they cut your femoral artery open, stick a wire with a camera on it up to the aorta, around and that arch going the other way, and they find the coronary, the aortic semilunar valves. Remember, the aortic semilunar valves have two openings to the coronary arteries, and one of them, the third one, is a dud. But they stick that thing until they find the right two, and then they inject dye. And if the dye disperses, you're fine. And if the dye doesn't disperse, you're not fine. Obviously, I wasn't fine. And then they come back and put a stent in, and then you're gone home. And then you, okay, I'll make a long story short now, because then you start watching some of the things that you eat, so that you can be around 25 years later anyway, with no further complications. Okay. Anybody want to add to the conversation that I started? I'm sorry.
I was gonna say my dad had the same procedure as you.
Yeah, it's common. Actually, at first I had a angioplasty where they just enlarge it, but those things fail after 10 years, and so they put in a stent. They're supposed to fail after 15 years. Mm, You know, I really watch, what goes in my mouth now, and don't seem to have much trouble. I had a chemical stress test. I had so many physical stress tests done excellent on all of them. They cannot find any damage. I can't find anything wrong at all anymore. That's the way I'd like it. So, okay. Well, when we come back from a short break, 10 minutes, if that's okay with you, we'll do the number eight, and we will do the heart models and specimens. We'll finish this. Okay. So it's 3:05, 3:15, please. Okay. Okay, howdy.
Hi.
Okay.
Hi.
Hello.
The
Hi.
okay, howdy. Okay. Uh, the chat question that came up was, is the heart muscle going to be on the second practicum? Heart muscle is going to show up from now on. By heart muscle, I don't really know what is meant. There is no one heart muscle. Okay, but if you're talking about the structure of the heart, yes, that's going to show up. You're going to be asked to uh, label structures of the heart. Okay. Now, I'm going to go over some of those right now, and then when we come back from the, let's see, right, then we have next Tuesday to go over the material as well, because the test is now on Thursday. Okay, any questions? Okay, you can still see the screen? No?
No, we just see you.
Okay. Now can you see the screen?
No.
Okay. I was just trying to shortcut. Now?
Yes.
Yeah, we can see it.
Okay. Okay, so where I am, we just did this little lecture called Heart. Okay. And then for call it lab, should be 311 now. And now it is. We'll take a look at this. Okay. I know we saw this on Tuesday, but the repetition is really helpful here. Okay. On this heart, this happens to be a sheep heart. Here's myocardium, here, here, here. It's the muscle layer. Okay. Endocardium represents everything on the inside, everything, not just where this arrow is pointing. And the epicardium, also known as visceral pericardium, is only the outside layer. So if this were uncut, you grabbed it like a softball, okay, you'd be holding the epicardium. Okay? If you cut it with a knife, you'd be cutting through the myocardium, and you'd be exposing these hollow areas and their walls, which is all endocardium. In this picture, it shows a few extra things. It shows the left atrium up at the top. Here's the mitral valve. The first thing to do in looking at this, you got to determine which is right and which is left. And there'll always be a larger left ventricle. Yes, it's possible to cut the heart and make the left ventricle look like the smaller of the two, but I'm not going to play tricks, okay? The mitral valve is here above the left ventricle. Okay. Here's the apex at the very tip. The IV septum is the area of myocardium between the two ventricles, the right ventricle being here, the left over here. Here's the tricuspid valve. Not labeled, chordae tendineae, little one here. Bigger ones on the left side, chordae tendineae. Also, trabeculae carneae, here, here, here. The meaty hollows that we talked about. The right atrium is up here above the tricuspid valve. Looking at this one, I probably would not present you with anything like this, but I think you can learn from it. This is the left ventricle. Okay. It's not perfectly straight. It's actually humped right here and reappears down here. It shows the trabeculae carneae, though, very well. It shows a papillary muscle, the muscles that the chordae tendineae attach to, which are here. Here's the mitral valve. From the left atrium, blood is going to move into the aorta, and it does so by going through this structure and into here. This is the aorta. This is the aortic semilunar valve. And you might be able to see it looks sort of like a cone on its side. And when the blood tries to come back in, it will fill that cone. That's just one cusp. One more cusp is up here. And the third cusp is actually under here. Okay. Now you do want to get to the point where you want to say, enough, I've had enough of this. You want to get to that point so that when it comes test time, you will do fine. So I'm going to go through these, and if I go too fast, you just slow me down. Here's the right atrium. Sorry, I lost my spot here. There we go. Okay. Okay, here we are. Sorry about that. I was trying to change the size. I must hit the wrong thing. You are able to see the screen?
Yeah, I see it, Charlie.
Thank you. Okay, here's the, as I was saying, the right atrium here. This is the tricuspid valve. 1, 2, 3 parts. This is the right ventricle. And it and the left both have trabeculae carneae. You can even see that waffling pattern on these flaps that have been pulled aside. Okay, muscular folds. What kind of muscle will have to be? Cardiac muscle. The blood flows out of the right atrium through the semilunar valve. This is the pulmonary semilunar valve. One cusp, two cusps. And now if you flip this back in place, there's the third cusp. It's going to fit right in there. The blood moves past that into the pulmonary trunk and then into the pulmonary arteries. Now remember, the pulmonary trunk and pulmonary arteries carry deoxygenated blood. Okay. This model is set up differently. Well, people's hearts are different too. And it shows the pulmonary veins carrying oxygenated blood over here. You can see three of them, the fourth is hidden. And they all are together in a line in this model. They enter in with their oxygenated blood to the left atrium. The blood then passes through the mitral valve into the left ventricle and go out through the aortic semilunar valve. The aortic semilunar valve does not show here. Okay, it should be right on the side here. The three layers of the heart. The outside is the visceral pericardium, also known as the epicardium. The thick wall is the myocardium, including the IV septum, which is right here. And the insides are the endocardium. Okay, a different type of model, different colors. None of these colors are real. Our hearts aren't anything like this. Here's the superior vena cava. Which way is it coming? It's coming this way. Back to here, to the right atrium. This right atrium has its pouch-like flap called the auricle. You call it auricle of the right atrium, or you can call it the right auricle. Okay, that's just an extension of the right atrium when we are exercising and blood is flowing faster. Okay. The aorta is here, arching over. Here's the left pulmonary trunk. There's an artery coming off over here. It's not well defined as it was on the other model. I would definitely ask off the other model. This is the left atrium with the left auricle, or the auricle of the left atrium. The apex is down here. And we can't see it inside, but here, this is the left coronary artery, comes out, then it splits to go behind and forward. And here's the right coronary artery. Okay, these two coronary arteries split into many smaller arteries, and they both originate from the cusps of the valves of two of the valves of the aortic semilunar valve. The posterior, this shows the trachea. So I don't want you to be confused by that. Some of the models actually will show an esophagus as well, just to be complete, naming things that are in the mediastinum. Here's the aorta. Now you have to turn it around in your mind. It's coming around and arching over. It's going to go down the back and become the abdominal aorta, unless blood comes out of these top three, 1, 2, and the third one's hidden. They are the brachiocephalic, common carotid, and the subclavian arteries. Don't worry about those names now. That's for later. But they go to the head region. Okay. Here are the pulmonary veins. They paint them red to indicate oxygenated, coming back from the lungs and going to the left atrium, which is located in here. Okay, so the left atrium, follow the arrow, please. Here. Here's the inferior vena cava on this view of the model. And here's the superior vena cava up here. Now, one thing that we have for finally is blood returning from coronary circulation gathers in a large vein on the back of the heart. It's right here. This is the coronary sinus, and it enters in right here into the right atrium. So three things enter the right atrium: the inferior vena cava, the superior vena cava, and the coronary sinus. Here's another auricle. This would be the right auricle. The right atrium would be in this area here. The apex down here, since this is at roughly a 45-degree angle, there's the apex. Here's the coronary sinus again. It's coming from the anterior of the heart, collecting spent blood that's made its round in coronary circulation. This is the coronary sinus. It is here shown entering into the inferior vena cava first, and then the superior and inferior vena cava emptying into the right atrium. It's possible that that is one way that it happens. The coronary sinus, whether it enters into the vena cava first or into the atrium first, makes absolutely no difference. It's going to have the same effect of returning deoxygenated blood for another go around. This is that same model. Here's the pulmonary trunk. Okay. Right here. This was the auricle of the right atrium. The model is such that you could pull away a portion of it. And this shows 1, 2, 3 depressions. This is the pulmonary semilunar valve. The 3 depressions, or 3 cusps, move apart from each other right at this point here and along their seams when blood is being pressed up into the pulmonary trunk. Okay, on this one, I believe this is the same model, but maybe not taken in our class because it's more colorful. This is the pulmonary semilunar valve. This is the pulmonary trunk. This is the pulmonary trunk. This is wrong. This is not the pulmonary artery. This is pulmonary trunk. It will divide into 2 pulmonary arteries. So I pencil in that there's something that needs to be fixed here. Okay, it'll be fixed. Here on this side, anybody want to guess what this chamber? There's only 4 chambers. What is this chamber? I call it the boring chamber. Is it right or left?
Left.
Right. I would correct. Okay, now it's left. Is it atrium or ventricle?
The ventricle.
No, it's the atrium. Okay, here's the pulmonary vein here, and you can't see the others on the other side. Okay. This is tilted on its side. It's a little confusing, but if you can get any part of it, you'll be doing well. And by the time the test comes around to ask you the question, you'll be doing great. Here's the mitral valve here. Here's the trabeculae carneae. Here is a very thick myocardium. And leaving the left ventricle, which this is, blood flows out through here. This is the aortic semilunar valve. It's three cusped as well. Well, we've seen this guy before, so what's he showing us different this time? This is the auricle, the right atrium, I showed you that. The left ventricle, the IV septum, I'm sorry, right ventricle, left ventricle, IV septum, and the left atrium. So you get to the point when you go over these pictures that you realize it's the same thing. It's the same thing, you know. Well, that's you want it to be that way. Well, here's the pictures again. Here's our tricuspid valve, our mitral valve, the chordae tendineae shows better here. The trabeculae carneae here, 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 here. The aortic semilunar valve doesn't show well in this picture. Okay, we've got to see it a moment ago. Pulmonary semilunar valve always shows well. That doesn't do us any good to tell us to look up there to see the semilunar valve. But here's the pulmonary semilunar valve. Okay, the closed heart, pulmonary trunk, superior vena cava, aorta. You don't yet have to know these. This is brachiocephalic. This is subclavian. This is common carotid. This is subclavian. We have a right and a left. Here's the pulmonary artery done properly. And here are pulmonary veins. Okay. You're not expected to know these three here. Okay. So I have a quandary. Do I let you waste a little bit of time studying for them now and take it away from the time you could for studying the real stuff that I sent you in today's email? Or do I remove them? What would you prefer?
I'd prefer you to leave them. That way, even if we don't study them, like you say, seeing them repeated over and over, it'll make it easier over time.
I think you're right. I don't think everybody would agree with you, but you're the one talking, so you get your way. Okay. And yes, I'll leave them. Plus, it's easier for me to leave it. Okay, but I got to fix that other one. On this side, this shows the trachea and the esophagus. The inferior vena cava is down here. The superior unlabeled is up here. Okay. Okay, I'm on week 8. That's where we're supposed to be. And we have finished the material that we need to. some of this material was dragged down, as I said, from week 7. Okay, so you are going to be doing the muscle soon. So it's down here. But here on the muscles, okay, extra credit models week 8. This is the extra credit quiz that I told you about. Okay, this this extra credit quiz is only 10 questions, and it only asks you to name muscles. And for each 2 that you get right, you get 1 point. Total is 5 points possible that will be added if you get all 5 or part onto the practicum number 2. Okay. Practicums always have the ability to get 5 points of extra credit, but I don't like to take up your practicum time with the extra credit. I'd rather do it first, and so I'm doing it here and ask you to study early. And so I did that, and so here's the test. You cannot take the test until 4 o'clock. It won't open up. Okay, but at 4 o'clock you can go in. The test, you only get 3 minutes. I know that sounds crazy, but my previous classes have done it in 2. So just make your best guess and or choices, and then some of you will get them all right. Some, but it'll vary. However, only 25 people bothered still after I told everybody to take the week 7 practice test. They didn't bother to even take that one, so I'm not going to give them any credit for this one. If you didn't take the week 7 practice test on digestive and urinary system, no need to take this extra credit test that I'm pointing to right now, unless you want to do it for practice. You'll find out your score, but I will not add it in to the practicum when we have it next week. I've said it before, there's a reason for these practice tests. They aren't necessarily to scare you, to make it seem hard. It's so you know which way to study. And if you don't care to have any help, it's possible to get an A without it. You don't need to practice tests, and you're telling me you're not going to get the extra credit on the practicum either, unfortunately. So I've got the test set up between 4 and 5. You can take it anytime between 4 and 5. Once you do, it's 3 minutes, and it'll submit it whether you're done or not. Always guess, that's for sure. Don't start at 5 o'clock, please. You got to end the test before 5. So if you start at 1 minute to 5, you're only going to get 1 minute for the test. Any questions?
Is this identifying muscles or muscle actions?
Muscles. This one is only identifying muscles.
Okay, perfect.
Okay, so what's going to happen here is that we're going to sign off, and you'll do this on Canvas, okay, not on Confer Zoom. Just if you get signed out, sign back in, and you've got until 3 minutes to 5 to get started on it, and it'll be collected for you. You can look at your answers and your score immediately, divide by 2, and that's how many I'll have on reserve for you for your practicum. Okay?
Thank you.
Okay, I'm going to end it now. So you
Thank
can
you,
take a little
Charlie.
break.
Thank you, Charlie.
Bye-bye.
Thank you.